we discussed everything you want to know about gastroenterology, but we're too afraid to ask. I thought I would present several topics that patients seem to have a little bit of anxiety about talking about, or apprehensive about talking, or they're just nervous and think it's a little taboo. So I touched on bloating, I talked about constipation, but other topics that seem to be swept under the rug are diarrhea, abdominal pain. People don't think it's important enough to bother their doctor with it because they probably feel like they've lived with it so long that it's not really a big deal. But when you really get down to asking patients questions, they'll tell you that it really interferes with their life, that bloating occurs after every meal, then it comes with some abdominal pain. It makes it so they can't concentrate at work, or then they have some diarrhea that takes them away from being productive at work. So while yes, in the end, these symptoms might not amount to a life-threatening condition, they can certainly dominate and control one's life. Usually bloating and constipation and diarrhea do not have an ominous root cause, luckily, thank goodness. I'm not telling a constipated patient that they have colon cancer. But that's why it's important to come in to the doctor so I can figure out what we really need to worry about. So the symptoms that I tell patients to really worry about are, what do your bowel movements look like? Do you see blood in your stool? Have you experienced an abrupt change? Have you lost weight? So having the symptoms that I talked about today that usually are benign in origin can have more serious etiologies. Thank you very much. I appreciate it.